topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Arizona, the beautiful state of Arizona. Welcome to another Ask the Expert show. This is our 16th year of bringing you the top experts in the field of legal, health, financial, and home improvement. Hey, for all of you who are out there losing your balance, numbness in your feet or hands, and pain in your legs and wondering what is going on with me. I've been to my doctor. I think you might be a candidate for neuropathy. We're doing a show today on neuropathy, and we are so lucky to have this is of all of Arizona, the top doctor, Dr. Patrick Sars. He's a certified neuropathy. He is, the name of his clinic is Center of Arizona, and all they do is they treat neuropathy. We're having no, we're not here. Oh, looks like he's coming in. We're having some technical difficulties today with Dr. Sars. Dr. Sars, can you hear us? No? Okay. Well, I'm going to get started because we've done so many shows with Dr. Sars, and I have learned so much about. There he is. Hi, Dr. Sars.
Wow.
Good afternoon.
Good afternoon, Steve. Sorry about that.
I was just telling everybody you're the top. When it comes to neuropathy, you are the top doctor in Arizona, that we are so lucky to have you. And, sometimes these family physicians will say, there's nothing we can do for you, or we've learned that maybe they'll prescribe some drug to you. But I'm telling you, you need to call Dr. Sars. We're running his phone number on the screen, and we'll be giving it out during the show. Dr. Sars, I've learned so much about neuropathy, and I am so blessed that we have you. You just explained everything so well. Tell everybody about your practice.
Well, I'm located in Mesa, but my practice, we can pretty much work with people pretty much anywhere in the country. That the treatment that we do is actually done at home. I've been treating neuropathy with increasing success for the last 17 and a half years. The treatments are actually done at home. There is nothing that will cure neuropathy that's on the market today. So this is an ongoing treatment. And so this is the reason that we have people doing the treatment at home is so that they can get it under control and then continue to treat themselves as needed so that it stays that way for the rest of their lives. I have a 98% success rate in the last 5 years because of the fact that in the 17 and a half years, I figured out who I can and who I can't help. And the technology that we use has advanced to the point that it has increased our ability to help a greater number of people. And so be a little flustered because of the fact that I was having a hard time with my internet here today. And so do apologize to anybody sorry you had to just listen to Steve for a minute. But
okay, that's enough out of you. Hey, Dr. Sars, we got a text right before the show. Good question, too. This is from Norman. He says, I think I have neuropathy after watching two of your shows. My question is your treatment something I have to do forever?
Yes. Um, the answer to that is yes, but it is something that initially when we have you do it, we're having you do it on a daily basis. You eventually get it to the point where 1 or 2 times a week is all that is necessary to be able to maintain the results from that point. Basically, neuropathy is caused by something else. Maybe the easiest way to think of it is as a symptom of something else that's actually going on in your body. And we're not dealing with the cause necessarily. I mean, in all actuality, to cure neuropathy from diabetes, we would actually have to cure your diabetes. Um,
Mm.
and so, because we don't have the capabilities of doing that, we need to continue to keep doing the treatment. It's just to a lesser degree because we can get the neuropathy under control. Then it's just a matter of doing it enough so that it does not come back. And that's basically it. So it's pretty easy to maintain from that point. That 20 to 40 minutes a day or a week from that point forward, that you sit down, and people that either do it in the evening while they're watching television or in the morning when they're having their morning coffee or breakfast, that you can get it done at that particular time and go on with your day 1 day a week from that point. The healing stage basically can vary. Some people, when we catch it very early, may only take a matter of a few months to get it under control. People that have more severe cases, we're looking up to 18 months to get it under control. And so these are the things that we evaluate when we do the initial consultation, is to determine the severity of the neuropathy and what needs to be done to get it under control at that particular point in time.
Hey, Dr. Sars, how painful is neuropathy?
For some people, extremely. For other people, they have no pain whatsoever. It just varies. We have different nerve endings that carry different sensations. Neuropathy affects the sensory nerves initially, is what we're dealing with, and at the skin level. We have different nerve endings that carry sensations for cold and for cool and for light touch and for pain and this and heat. Some nerves may not be involved. And so that if the pain fibers really are not involved in the early stages, people will not necessarily have pain. They'll have numbness and tingling possibly. And maybe start to have a little bit of balance issues because the nerve endings that are on the sole of the foot start to recede a little bit deeper into the tissue. But the nerves, the misnomer with all of this is that most people get told that the nerve's dead. But in all actuality, if the nerve was dead, you wouldn't feel anything.
Right.
There wouldn't be any numbness. There wouldn't be any tingling. There wouldn't be any pain. There'd be nothing. It's just be a stump. So the nerve's not dead. And basically, cells that still have activity can actually be regenerated. And it just depends on how much damage is done initially on how long it takes to get them back.
You know, there's people right now driving around in their car listening to the show, or they're watching, and they're wondering, what does neuropathy feel like? And I wanted to tell you this. I think I've told you this once before. Every time I hear about somebody falling in the bathtub, because I know the balance affects when you have neuropathy, I always wonder if they had neuropathy, Dr. Sars.
Well, yeah, because a lot of times the reason that they fall is that because of that loss of balance, they close their eyes to wash their hair. And you actually, with neuropathy, as those nerve endings recede, you start to use your depth perception more to maintain your balance. And so that can be a factor. I mean, some people just, they just slip, and that's that. It's not all falls in the bathtub are related to neuropathy, but a lot of times it can be because of the fact that they are reliant on their depth perception to maintain their balance. As time progresses, it can actually start to affect everything as far as proprioception, and can not just their balance, but even their ability to drive. That my mom basically, when it started to really progress and get worse, used this story, and that is that she went out to the garage one day to start the car, and the engine raced, and she would have sworn her foot was on the brake, but in all actuality it was on the gas because she had no idea where her foot was actually at.
Wow. And your mom is kind of the reason why you really started delving into neuropathy. Is that right?
Yeah, my parents' lives were changed dramatically from what it could have been. That my mom's neuropathy started when I was about 12. She was in her late 40s. By the time that she was in her early 60s, she was already fully confined to a wheelchair, and remained that way for the next 16 years of her life. It limited a lot of what my parents were expecting to do during their retirement years, and it limited some of the things that my mom would have loved to have had the opportunity to do. That my mother was very heavily involved in politics, and in the 1960s, my dad actually was in the Montana legislature, primarily due to the fact that in '65 they wouldn't elect a woman, but it was my mom that was actually the one that was really the push from that aspect. And in the '70s, that kind of changed, and my mom had actually been asked to run for lieutenant governor in Montana, with the idea that
Wow.
that would get her name out, and then she could run for some higher offices. And by that time, my mom's neuropathy was to the point where she knew that Montana is the fourth largest state geographically, but you have to search to find people. And so that she knew that she wouldn't be able to go from small town to campaign, which was kind of devastating for her. That something that she would have really enjoyed.
So, Patrick, what are some of the symptoms? I mean, someone's driving around their car right now saying, gosh, I've had certain things happen that my doctor doesn't know what it is. What are some of the symptoms that people should look for?
Early on, it could be numbness in one leg or foot. It's not unusual that it starts on one side, and then it may migrate over to the other side as time goes along. But when you sat on your foot and on your leg, and your leg goes numb, that type of sensation that comes, and initially it's off and on. It's like, oh, geez, it's that way 2 or 3 days a week. But it is a progressive disease. It does get worse over time. And so when these things start, it's best to get it checked out to see whether or not it is actually neuropathy. Because if we can jump on it at that particular time, getting it under control is minimal. And we can get it so that basically it never really develops into anything seriously. But unfortunately, human nature is that our thought is, oh, it'll go away on its own.
Right.
And so it's really nothing. It's just, I slept wrong, I laid on it wrong, I sat on it wrong, whatever the case may be. And this unfortunately can lead to some problems further down the road.
So what happens if you don't get it treated?
It can become very painful. It can truly get you to the point where you are walking with a cane, a walker, or end up in a wheelchair. The misconception is that, and this is used to frighten people into starting a treatment, is that it's always going to lead to an amputation. And that is a misconception. There's about 180 non-traumatic lower limb amputations. And when I say lower limb, that could be your big toe, it could be your little toe, in the country each year. But with 25 to 40 million people having neuropathy, that's an extremely low percentage that actually has an amputation. It is basically something that people that have neuropathy clinics use as a fear factor to get you to sign up for their particular program, whether or not it actually works. I'm not sure. There was a clinic. I have one of my patients is actually a medical doctor. And so he goes around and kind of sees what's out there. And he went to a clinic here locally for a free consultation. And they came up with some obscure things on how they were going to treat neuropathy, and did some testing on him and different things this way, and then sent him merrily on his way, and then sent in $9,000 worth of charges for an hour and a half that he was in the office to Medicare, and they got paid $3,000. He in turn contacted Medicare and let them know that there was not supposed to be any charge, and that half the things that they actually charged for had not happened. And so Medicare went back out and got the money back from them. But I try to be very straightforward and very ethical. And not everybody is.
I got to tell you something. I waited for the show. I could not wait to tell you. I had about a week ago an internal medicine doctor contact me. He would not tell me, maybe he wasn't even an intern, but he acted like he sure was. He listens to your show all the time. And he didn't tell me what kind. He said, I'm internal medicine. He said, I have learned more from Dr. SARS about neuropathy than they ever taught us in medical school. And he said, I'm so embarrassed as a doctor that I didn't know more about neuropathy. And he said, I think back on some of my patients that they probably had neuropathy and I didn't know it. And he just complimented you up and down, Dr. SARS.
It's very nice. That it's not as common now, but when I started 17 and a half years ago, it was commonly misdiagnosed. It was just not thought to be that prevalent. If you went in and you had numb feet, the first question out of most doctors' mouths was, "Are you diabetic?" And if you weren't diabetic, then they really didn't know what the heck it was. They didn't attribute neuropathy to any other cause. But there are, in the literature, if you go on the internet, it'll say there's 100. But if you listen here locally, there was a Mayo's podcast here a few months ago. They said there were 200 causes for neuropathy. And I do believe that the number of causes is increasing. That when I started 17 and a half years ago, everybody that came into my office is the age I am now, which is in my early 70s. And now I'm starting to see patients as early as their late 30s and early 40s.
Wow.
And that's frightening. I mean, people don't realize how disabling neuropathy can actually become. It does lead people to get into a wheelchair. It does lead to them losing their independence.
What about, does it disrupt sleep, Dr. SARS?
It can, because of the fact that the nerve endings at the skin level, as they recede into the tissue, we still have normal nerve endings. So that during the day, when you're up on your feet and you've got your shoes and your socks on and you're doing things, you're stimulating those normal nerves, and it'll kind of override the abnormal sensation. I refer to neuropathy as a majority rule disease. And that is, if you got more normal nerve endings than abnormal, you really don't have a whole heck of a lot of symptoms. But at night, you take your shoes and socks off. There's nothing really stimulating those normal nerves. And so the abnormal ones become more prevalent at that time. And so, yes, the abnormal sensations can become a lot more intense, and that can be very disruptive for some people.
So when they come to your office for the first time, how do you diagnose them? Is it a machine? Is it blood work? Or do you just know?
No, we actually do a sensory exam that was developed by a couple of neurologists about 22 years ago, called the Toronto Clinical Scoring System for Peripheral Neuropathy. Basically, it's a sensory exam that we test for 7 different sensations in the lower legs, feet, in the hands and arms if they're having problems there, comparing how they feel there to a spot on your face or forehead. We need a comparison. that just to go and see whether or not you can feel the sensation of heat. If you have nothing to compare it to, you could blow and go, okay, yeah, I can feel the heat, but it's only 30% of what you should be feeling. When everything is normal, you have the same nerve endings up here in your cheek that you do in your big toe. You should feel everything the same way. If there's a decrease, so we test for these 7 different sensations. We also do a simple saliva test for a compound called nitric oxide, which is extremely important in dealing this. It helps to get oxygen into the nerves or into all tissues, basically, and kind of go from there. Common way that neurologists will actually diagnose this, they'll do an EMG or a nerve conduction study, which can be a very painful study, but it actually also has only a reliability of about 60 to 65% of actually making an accurate diagnosis. This is the reason that if some people go to 2 or 3 different neurologists for neuropathy, they'll end up with 2 or 3 different EMGs or nerve conduction studies done, because of the fact that the reliability, they're not sure how the technician was at the last neurologist and how reliable he was, that they trust their own. So you end up going through this rather painful test a number of times and still may not necessarily get an accurate diagnosis.
Tell people how they can reach you, Dr. Sars.
You can call me at 480-556-1358. That phone is answered from 7 o'clock in the morning till 8 o'clock at night, 7 days a week, with the exceptions of when I'm in the shower or church. Outside of my office hours, I am the one that actually answers the phone. As I've said, my patients treat themselves at home. And so I make myself available if they have questions while they're doing the treatment, and that I'm available to answer those, because the only way this actually works is if they actually do it. You can go on my website, isneuropathycurable.com. We have links that you can send in for information. If you just have questions, please feel free to call. You don't have to be a patient to call me and have me answer a question. I'm more than happy to do so. My ultimate goal basically is to make sure that is to limit the number of people that end up like my mom, that my parents wanted to do a lot of traveling and do different things this way, and they didn't get the opportunity to do that. And we can make it so that people can.
Dr. Sars will be back again with us next month. Dr. Sars, thank you so much. I'm glad we got everything worked out.
Me too. It was
Okay,
good
buddy.
to see you, Steve. Take care.
See you next month.
Yep. Bye now.
We're going to go to a small break. We'll be right.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.